said, just how I want you to do it in your demo, so I'm not going to break character, if you like. I'm going to do the demo. All right, so Mr. Jones, welcome to the clinic, and I understand that you're here to have your thorax and lungs examined. And I'm just going to sleep for it, and I'm going to begin the procedure. I'll need to touch you during the procedure. Is this all right with you? Thank you. Okay, I'm just going to wash my hands. I'm going to provide for privacy. I'm going to collect my equipment, and I'm going to position you. So to start the exam, I'm first going to start with inspection. I'm going to look at the chest. I'm noting contour and symmetry of the chest. I want to make sure that the scapulae, the bases of the scapula are in line. I want to see that the iliac crests are in line, and that the thoracic vertebrae are in a straight line as well, because I want to make sure that that there is no scoliosis or lordosis, because that will affect breathing. Next, I'm going to look at skin color. I want to see that the skin color is the same all over the body, that there isn't any areas that would indicate poor oxygenation, looking for masses and lesions, and just general condition of the skin. Next, I'm going to take respirations, and I will take respirations for 15 seconds. And I get them to be 14. Normal respirations are 12 to 20, so I'm not going to go back and take them for a full minute. One of the steps I forgot first was the general survey, so I'm going to go back to that. The general survey, I'm going to notice body position, note whether the person is trying to make their chest or support their chest muscles, suggesting they have difficulty breathing. I'm going to notice the facial expression to see if there is any sign of the face showing anxiety that might indicate that there is some difficulty in breathing. And I'm also going to determine level of consciousness. So I'd like you to tell me what day it is. There's my 7th of March, good. And you know where you are. You're in the nursing lab. Excellent. Moving on, we're going to go to palpation. And I'm first going to palpate the anterior and the posterior aspects of the body, feeling the ribs and in the intercostal spaces. I will avoid the breast tissue because it doesn't give you good data. Doing both sides of the anterior and the posterior. I'm feeling for masses, lesions, tenderness. Please tell me if there's any pain when I press down, and any signs of infection, so there might be lump there. Great, and I don't feel anything of that nature. Next, I'm going to do posterior lung expansion, so I'm going to place my thumbs just on either side of the vertebrae, thumbs together, pinching up some skin. I'm going to ask you to take a deep breath, and my hands move apart as they should to indicate that we'll get good expansion. Next, we're going to go on to percussion. So I'm going to percuss the general lung fields on the posterior aspect only. I'm staying medial to the scapulae because you don't get good data, you won't get resonance, which is what you should have over the lung tissue. And I hear resonance when I do the general percussion. Next, I'm going to determine diaphragmatic excursion. So I'm going to start at the 3rd intercostal space, thereabouts, just inferior to the scapular border, and I'm going to percuss down. But first, I'm going to ask my patient to take a deep breath in and then breathe out and hold it. At about the 7th or 8th intercostal space, I'm going to hit dull, which means I have the upper border of the diaphragm. I'm going to ask the person to take a breath in hold that breath. I'm going to continue to percuss down. I'm going to note the difference where I have dull, and it should be 3 to 5 centimeters. Back to palpation, we're going to do tactile fremitus. I'm going to use the palmar aspect of my hand, and in between the intercostal spaces, I'm going to press down and ask my person to say 99, 99, 99, 99, 99, 99, 99, 99, 99. So I can feel vibration throughout the chest, but it's most marked in the bronchodisticular area. All right. Now we're going to do auscultation. So I'm going to auscultate the anterior and the posterior chest in a step-like fashion. I'm going to ask the person to take a complete breath each time I put the stethoscope down. I'm listening for adventitious sounds. On the posterior side, away from the scapula again. Step-like pattern all the way as I get lower, going to the sides. Okay, and I don't hear any adventitious sounds, but I am going to perform the 3 tests regardless. So I'm going to do, first of all, whispered pectoriloquy, and I'll just auscultate on the posterior aspect with whispered pectoriloquy. So I'm going to ask my patient to whisper 1, 2, 3, and I'm going to listen. Normal finding is that the voice is very blurred, very muffled. I can't hear it very well. Next, I will do bronchophony, and I'm going to ask the person to say 99 or blue moon, and I'm going to auscultate again. 99, 99, 99, 99, 99, 99, 99, 99. And a normal finding is that I can't hear it very well. The voice is quite muffled. I'm going to do a gophony, and so I want the person to go E as I put my stethoscope on the dorsal aspect of the chest. And I'm going to listen. E, 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 E. E should sound like E. If it sounds like A, that means that there's consolidation in the lungs. So all normal findings. So I found after doing the health assessment on your lung and thorax that everything is within normal findings.